The hysteroscope is introduced by vaginoscopic method where the ostia is seen and the external loss is negotiated by keeping it at 6 o'clock. The hysteroscope is introduced while examining the whole cavity as well as the canal. We can see a small polyp lying in the posterior part of the isthmus of 1 centimeter and 1.5 centimeter. Whole of the cavity is inspected to look for any other abnormality. Both ostia are visualized, anterior, posterior walls are visualized. No other growth or polyp seen. So, a decision to introduce a, a scissors is done because the polyp looks benign on the surface. It's smooth, white, it's a simple stalk underneath, and it can be done by a simple scissors. No need to use a resectoscope because it doesn't seem to be malignant or fibroid polyp. So, all the walls are inspected and a decision to introduce scissors is made. Here we can see the stalk is also avascular. It's a small polyp and can be removed easily. It's white, glistening with healthy appearance. A scissor is introduced and it's used to cut the stalk and the base. Simple 4-5 cuts will do the job. There is no need of current in this as it is avascular. The cut end, the moving end should be facing the cavity, and the fixed end should go into the base. We don't cut whole of the polyp by the scissors because if it gets detached from the wall, it is difficult to remove and find out in the cavity where it is. So once a little bit of stalk is left, then it is left there, and we will introduce a grasper to hold that little bit, twist the tissue and hold it and remove it along with the grasper only. If we cut the whole of the polyp, it is very difficult to remove then. We've given a lot of cuts and now we see that very little bit of tissue is left from one side. Here it is. We are almost done with the cutting. We can see it is separated from all sides except for a little stalk on one side. So now the grasper is introduced and the stalk is held with the help of the grasper. Here it is. With a little movement, we can see that we can just go till the stalk and hold the polyp, and it is still dangling in the cavity with the little stalk. Just holding the stalk, bringing the whole, we can see it is dangling. So we try to hold the stalk with the help of the grasper and remove the whole polyp along with the assembly of the hysteroscope. The polyp comes out with the grasper. A re-inspection is done to look for any part of the polyp being left inside. The walls are inspected if there is any bleeding or not. By the pressure of the water only, if there is a little bit of bleeding, it stops. So there is no need to use any current in this. This whole procedure can be finished in just 2 3 minutes. A small abnormal area seen on the right side is also biopsied with the help of a grasper only. Tissue is taken for biopsy. The stalk can be seen, it is not bleeding, there is no other remnant of the polyp left. So we decide to leave it here, and while coming out, we should keep inspecting the cervical canal also. If there is any growth or any polyps, they are also biopsied with the help of the grasper. We can keep inspecting and coming out. Because she has come with heavy menstrual bleeding, we must see the cervical canal. The by vaginoscopic method, even the growth seen on the ectocervix can be visualized. So this is the advantage of using the vagina.